Hey Nurse Family, it's Nurse Erica here and you're watching your Shift Report where we talk all things nursing. And I'm so excited about today's episode because I have my very first guest on the show and I know you guys are going to love her. My first guest is a mom of 3 and a nurse in the ICU. She is going to talk to us about her journey through nursing school as well as her time in the ICU during COVID-19. So if you like today's episode, go ahead and hit the like button, and if you haven't already, subscribe to my channel for more videos like this, and make sure to hit the notifications button so you're notified when I post a new video. Alright, make sure you stick around because you're not going to want to miss this, and you're definitely going to want to see the outtakes. Alright, so I want to welcome my first guest, Diane. I'm so excited to have Diane on the show. I mean, she is just completely honest and transparent about her journeys and struggles through nursing, yet so passionate about the career. So welcome, Diane.
Thank you for having me. I'm honored to be your first guest, and I'm so happy for you.
Oh, thank you. Thank you. It's great to have you here. So before I get started and get really deep into these exciting questions I have for you, I want to first know, how long have you been a nurse?
I'm going on my 11th year.
Okay, nice. So 11 years. And I want to know more about your nursing school journey. I know that you had children. You had 3 children while you were in school. So tell us about that. What were some struggles or some shortfalls, and what were the positive things that maybe came out of it?
I went to nursing school when I was about 38, 39. And I had always wanted to be a nurse, and I just never thought I was smart enough to do it. So I just woke up one day and decided, if I don't give myself this gift, nobody else will.
Good for you.
Thank you. And so I went back to school. Some challenges were trying to really manage my time properly, and being an older adult in a school with 20-somethings, trying to find a clique, if you will, or a group to study with, because study groups are really helpful and conducive to testing and getting the information, because now you get feedback. And a positive thing for me was when I would have my books and I'd be studying at the table, my children would join me and open up their books.
That's awesome. And you said they were 8, 10, and 12? Is that right?
I believe so, yes.
8, 10, and 12. Wow. And those are really important ages, right?
Yeah.
I mean, those are like when they really start to become their own person, like it's the beginning.
Yes.
So did you feel like it brought you closer as a family? And like they were, I always think as a mom, it's also, it's a little bit exciting to see your kids watch you go through these struggles and still persevere. Like, how did they feel about you when you finished nursing school?
Oh, they were so proud. It's going on my 11th year in nursing, and my son still has on his phone ID the pic of him and I with me in my cap and gown.
Oh, that's awesome.
So they really viewed me as their hero. They were inspired and so proud of me. So I think it had a real big positive effect to see that their mom could do all these things and still be their mom.
Yeah, nice. Yeah, that's exciting. So that being the case, what is your biggest advice for someone who's a mom or a dad, right? Let's not forget about the dads.
Yes.
And wants to go back to nursing school. Like, do you say, no, don't do it? Or what do you think?
No, I believe innately, as everybody who really pursues this has a passion for it. And that passion is what drives you to be your best and to learn more. So don't give up, pursue it. There's many ways to cook a roast. Everybody has their recipe. There's many ways to become a nurse. And if you want it bad enough and fight for it, it's so rewarding. I'd say go for it. Don't stop your dreams.
Now I kind of want to get into you as a nurse, right? So you pass your boards and you go for your first job. What was your first job at a nursing school?
In nursing school, we had a program called Trends, and you had to do 72 hours in a specific field of nursing.
Okay.
And I was lucky enough to get ICU.
Oh, wow. Okay.
And
Where you were working?
yes,
Like where you ended up working?
where I still work today.
Wow.
So I did those 72 hours, and I knew then that that's exactly where I wanted to be. And I had the opportunity to have the nursing director approach me at the time and ask me if I was interested. I should forward my resume to her.
Wow, excellent. So I know right now a lot of you aren't in clinical areas, but it is something to think about when you're in the clinical area for your capstone or your trends, your clinical. Always make a good impression, because you never know who's watching and might be hiring you for your new nursing job, your first nursing job. All right, so a question I always get from my students is, should I start in my area of interest? So for example, some of my students are interested in critical care. They want to work in the emergency room, the ICU, or at L&D, and they often hear that they should start in med-surg. Now we do have to really think about the fact that our students are not getting the clinical experiences that they usually do. So what is your recommendation? Do you think that a student, obviously these are our opinions, okay, but do you think that a student coming out of nursing school should start in their area of interest? Do you think they should start in med-surg, or what do you think? Let's talk specifically about ICU, because that's your area of expertise. How do you think they should best prepare?
I say for me it was a little bit different, because I was in the medical profession prior. At 17 I was a nursing assistant, so I was familiar with patient professional interaction and certain things that if you're truly green and out of school, you're not comfortable with. It takes time to get used
What are
to.
those things that you would say a new nurse must possess when starting in the ICU? Because I mean, we're talking about critical patients who are relying on us to think fast, right?
Think fast, or think on your toes, because these patients, well, in critical care, that's why patient ratios are 2 to 1, because every nuance is so important.
Right.
That hourly urine output, the patient's labs first thing in the morning, getting to know these small things and the differences that there are mean everything to a patient's recovery.
Right.
So being a new nurse, time management, patient-family interaction, these are things and skills that are honed over time. But you must be astute enough to know that you don't know everything, you won't know everything,
Right.
and it's okay to ask questions.
Yes. I think that's really good. That's what I always tell my students is, don't be afraid to ask a question because you feel you should know the answer. Now you just continue not knowing the answer rather than asking the question despite, feeling that you should know it and maybe feeling dumb or insecure.
Right.
Now you have the answer.
Right.
And most importantly, you want to keep your patient safe.
Absolutely. It's everything. And I think there's so much pressure on a new nurse.
Oh, yes.
To perform, to feel like they fit in. And there's an unspoken rule in nursing where nurses eat their young. And so the environment can be a hostile environment. And I think innately human nature speaks to, wanting to just close up and just keep to yourself. Whereas in nursing, you really need to humble up and ask questions despite the environment you're in. Because every life matters in that situation.
Right. Well, I also think about when new nurses, like my first year, I felt the most insecure as a nurse. And then I did 2.5 years on telemetry and went to ICU. And that first year of ICU, I felt extremely insecure again. So I think that starting as a new nurse in the ICU has to be challenging. Did you regret doing that? Or did you feel like that was where you belong?
Looking back now, the first 5 years were probably the toughest of my career. And every year has a different challenge, but if you're not challenged, you're not growing.
Right. Okay, so I want to talk about more recently your experience as a nurse in the ICU during COVID-19 I know that your hospital was hit pretty badly, and you took care of several COVID-19 patients. So you were very transparent about your struggles during that time. I know that a lot of nurses spoke out about the lack of PPE, the lack of support, but you went as far as to go on the CBS morning show and advocate for nursing and for your staff. I thought that was amazing. You want to talk a little bit about that?
Sure. This COVID-19 is just unprecedented where we are in history. And for Pope John Paul to claim this the year of the nurse was almost like the biggest, whoa, wait a minute, what did he mean by this? Because now what are we dealing with? And oh dear God, I hope everybody hears our prayers. It was, and it is, the most challenging thing I've ever had professionally, personally, and it's affected a lot of my colleagues, and it's affecting America today. This is the biggest challenge to healthcare, and I feel that it was important for me as a nurse, as a sister nurse, and a mom, to advocate, and as a woman, more importantly, to advocate for the needs of all healthcare professionals, to appeal for help, because it was something we were not prepared for.
So, I guess, without getting too political, you know, recently I had a family member send me a video about there actually being a medication that's saving people, but accusing the media of hiding it. Is there a medicine that you in your hospital have, that you have witnessed being used in your hospital that has been effective in treating patients with COVID-19?
We went through several medications, in lots of heart attacks because of another particular medication that was peddled quite highly. Right now, the best treatment is as much as possible to prevent intubations and steroids.
So you, in your experience, steroids and delaying on intubation
has been somewhat conducive, and plasma transfusion.
Towards the end, I know that we spoke a little bit before this interview, and she mentioned that the COVID-19 has, you know, you really haven't had many patients with COVID-19 as of recently, although she did have one admitted right before she went on vacation this past week. So it's still around. Just to let you know, we are in the state of New York, but we're doing much better with our cases. Towards the end, do you feel that you were managing it better in the hospital, or was it that we were wearing our masks? What is it? What do you attribute to the fact that we are now at less than 1% in New York?
I believe it's definitely everything that New York has gone through. We were inundated. We were overwhelmed. Our ICU went from one 16-bed ICU to 4 ICUs.
Wow. Okay. In a small private hospital, just to give you a little background.
Yeah, within the course of 1 month.
Wow.
Professionals that worked in many different areas were forced to become ICU nurses.
Yikes.
And so, going back a little bit, the reason why we're so much better is because people are wearing masks. And I don't know of another better preventative measure except for believing in the science and allowing science to dictate our next steps.
Right, right. As a nurse, I would imagine that experiencing COVID-19 the way you did, and then hearing people say that it's not real or you don't need to wear a mask, I would imagine that that is very upsetting. Because I get upset and I didn't experience it the way you did.
Yeah, it is the biggest slap in the face. And I'm humbled because not until recently did I actually correlate this to, on a different level, but still more of the same, as a soldier returning back from war. And not getting a job, not getting the recognition, not getting the gratitude for fighting for this country. Nurses were left on the front lines with no PPE. I went into debt over $2,000 just acquiring PPE for my unit and for myself, to keep myself safe so that my family wouldn't be at risk. And this is the biggest slap in the face when you see people out in the street saying, this is my right. It's not about rights, it's not about freedoms. Absolutely. It's about loving your neighbor, loving your family members, loving everyone who comes in contact with you, enough to say, I will wear this mask as a sign of respect for mankind. And when you see these incongruencies, it just becomes so hurtful, and you have to work extra hard at not taking it personal.
Right. I can't even imagine how upsetting it must be. Well, I do kind of want to get a little into the positive things that we saw during COVID-19. I know you also posted a lot about, just the support that you received from the community and just people bringing food and tell us a little bit about that.
Sure. We were day in and day out. If I could just paint the picture, the ICU is full of COVID patients, all COVID patients, and they each are on no less than 6 IV drips. Some are paralyzed because we can't have them move so that we can protect their airway and oxygen saturations. We couldn't turn and position patients, and it's what we do, because their oxygen saturation would go from 92% down to 70%. This is not seen in the medical profession. This is not seen before, that somebody with an oxygen saturation of 70 can still survive. So we were there with buckets, basins of meds and IV fluids at the nurse's station because it took too long to even run to the supply room to get the stuff to change IV bags. The way we did things in our ICU was drastically changed, from mixing our own drips to having drips already made. Those are things that we advocated for. To get extension tubing, I was online asking people to please, whoever had contacts with pharmaceutical companies, get us extension tubing, get us PPE, and in all that rush for my colleagues and I to try to figure out ways to not use up PPE, if we had extension tubing, then we didn't need to go into the room to change the IV fluids. These things became great helps. But out of this outpouring on social media came the inpouring of support from communities, police departments, fire departments, and a very special friend of mine who is a realtor started a GoFundMe for our particular ICU, and we were adopted, if you will. In all of this, where I thought we would get support, I was disappointed in my expectation of it, but I was pleasantly surprised that the community got together to support us, and that's what fueled us, because we would literally take turns or just each know to give each other space to go cry, because we were running up and down the unit just not doing our usual. We couldn't document the way we normally document, until finally I had a nurse practitioner tell me, hey, let it go. We're in a war zone. This isn't nursing in the regular world. This is war nursing.
Wow.
So you just write a note and never mind anything else, because there wasn't any time.
Right.
But you had to get home.
All right. So on that note, I know that just even listening to you and looking at you, that it stirs up a lot of emotion and a lot of pain there. How are you coping with all that you saw during that time, everything that you went through. You know, I know before we started the show, Diane was sharing with me that she was quarantined in a hotel for several months so that she wouldn't, you know, put her family at risk. So you're also isolated during that time and not around your family. So tell me about how you were coping. How did you ever feel like you wanted to quit? Like, did you ever feel like, I'm not going back to work tomorrow, I'm sorry, deuces?
There were points where I felt like, how can I keep on? But that passion, that adrenaline rush, not wanting to leave my colleagues because we were thin as it was. You know, 2-to-1 ratio in an ICU is what's considered safe. And some of us had up to 7 patients to 1 nurse.
Wow.
So not wanting to let your colleagues down and wanting to at least make a difference in somebody's family members' lives, because we were family. We were everything for each one of those patients. So no matter how tired I was, that adrenaline kicked in, and that's what helped me to return each day.
So I know that you mentioned you did attend a course. Do you want to tell us a little bit about that and how that's helped you to cope? You know, the one thing that I think, even prior to COVID-19, the beautiful thing about nursing is that we really are with people at their most vulnerable. You know, we get to be the first face that a baby sees when we welcome them into the world. And we're also the last face that someone sees. And most of the time, we're also supporting the family and going through this. So going through COVID-19, that has added a completely different layer. I think as a nurse, it's so important that we have healthy coping. What is it that you did to help you to cope and to keep going?
I happened to be listening to a lot of different nurse blogs, and I was searching for something, and one day on my feed in Facebook came across this healing healthcare burnout sponsored advertisement, and I was like, well, what is this about? And it was because I felt pretty burnt out, and I wondered how much more. And I listened to this free speech about where most people in healthcare get burnt out and different ways of coping, and how this program offered coping measures or life skills. And it really tugged at my heart. Everything that the person who runs this course was saying really spoke to me, and I enrolled. I was 2 months in a hotel, but I used that time to really try to get the help I needed to fix how I processed everything and how I could continue on.
What would you say are the most effective strategies that you learned? I just want to kind of give our viewers, our student nurses, our new nurses, something tangible that they could do to maybe help them if they're going through this right now.
Sure. I would say journaling is an incredible tool. Sticking to a schedule, a strict wake-up time, a strict shut off your phone at nighttime, no television, but give your body, your mind, and your soul time to process what occurred during the day. Yet, when you begin a day, begin with nourishing your mind, body, and soul. Fresh water in the morning before your first meal. Replenish, replenish, replenish. One thing I practice and I learned from this course was every day in the morning and at night, I make a list of my brags. What did I do good today? 5 good brags. And gratitudes. What are the 5 things that I'm grateful for right now? And it helps to ground you as a person. It helps to fill your soul, because rarely in healthcare do you get a, wow, that was awesome how you did such and such.
Oh, yeah.
But, and it's true, the saying goes, people may forget your name, they may forget what you said, but they'll never forget how you made them feel. And that's the biggest part of nursing.
Right. there's no award show for us, right? But there's definitely a lot of great rewarding experiences that we've had.
Yeah, they're priceless moments.
They're priceless moments.
Priceless moments of, and not to say that we need anything monetarily, but in the gifts, in the food, in the gratitude. Human nature is so incredible, and it speaks volumes.
Right.
And when you do God's work and you do the healing work, that transcends the soul.
Right.
So there's so much to feel good about, as far as a nurse, to be proud of what you're doing every day. And if you're taking care of yourself, that means it's going to transcend into taking care of your patients and their families.
Mm-hmm. Isn't she good? I feel like it's Super Soul Sunday, y'all. So that was excellent. Any last bit of advice for our new nurses or people going in? I have a lot of students who are even just starting their nursing school journey. One piece of advice that you would give them?
I would say follow your passion and believe in yourself, because that's going to lead you through so much.
Awesome. Well, that's your episode of the Shift Report with my good friend Diane. If you have any questions or comments, you can go ahead and write them in the comment box, and I'll be sure to be forwarding them to her. If there's anything specific about the course that she took, about her journey through ICU, about her journey through COVID-19, feel free to go ahead and write those in the comment box. I hope you enjoyed. Thank you. And thank you to my guests.
Thank you for having me.
Air hug. Emergency room. L&D. Shit. No, there he is. Okay.
Damn.
Don't mess with my interview. And we got that on camera.
She mean business.
I'm gonna put that in the edit. That is too funny to miss out on. I'll put it in the end. Oh gosh. All right.